In 1846, a man sat down in a chair in Boston and let a stranger cut into his neck. He was awake. He felt everything. And this was not unusual, it was Tuesday. For almost all of human history, surgery meant being held down by strong men while another man worked as fast as he possibly could. Not because he was cruel, because speed was the only mercy available. There was no way to switch off pain. So the question is simple, and the answer is stranger than you would guess. What was it actually like? Not the idea of it, the real thing. What did the room sound like? How long did it take? And what happened to the people who lived through it? Stay with this one, because the moment it ended is one of the strangest scenes in medical history. Start with the scale of the problem. Pain is not just unpleasant, pain is a system. Your body treats serious injury as an emergency and floods itself with hormones. Your heart rate climbs, your blood pressure spikes, and if the signal is strong enough and long enough, you can die of the response itself. Surgeons knew this. Everyone knew this. Which is why before the 1840s, surgery was almost never done to improve a life. It was done to save one. You did not get an operation because your knee hurt. You got an operation because you were going to die by Friday. The list of procedures was short and brutal. Amputations, removing stones from the bladder, cutting out tumors near the surface. Anything deep inside the body was essentially untouchable because the patient could not stay still long enough and could not survive the shock. So how did they cope? Mostly badly. There was alcohol, which does very little for real pain and makes bleeding worse. There was opium, which helps, but the dose that stops surgical pain is uncomfortably close to the dose that stops breathing. There was a leather strap to bite. There were assistants whose entire job was to hold the patient down. And there was speed. This is where the famous surgeons came from. A great surgeon in that era was not the most precise one. He was the fastest one. Robert Liston in London could take a leg off in under 30 seconds. Crowds came to watch. Students timed him with pocket watches. He would call out to the room to start counting, and it would be over before they finished. Think about what that actually means for the person in the chair. You are awake. You are strapped or held. You can see the instruments because there is no reason to hide them. The room is not quiet. There is an audience because operating theaters were literally theaters with tiered seating and spectators. And then it begins, and it does not stop when you scream, because stopping would only make it longer. Survivors described it in the same way, over and over, across different countries and different decades. Not as agony exactly, as a kind of total, roaring absence, where the world narrows to one point in time, stops behaving normally. One woman who had a breast removed while fully conscious wrote about it afterwards and said the terror was worse than the pain, because she could see everything coming. Now here is the part that changes the story. The tools to end this already existed. They had existed for decades. Nitrous oxide, laughing gas, was discovered in the 1770s. Ether was older still, and people knew these substances did something. They knew because they used them for fun. There were laughing gas parties. Traveling showmen would give it to volunteers on stage, and audiences would howl at them staggering about. Ether frolics were a student pastime. So for roughly 50 years, the answer to the greatest source of human suffering in medicine was being inhaled at parties, as entertainment, while a mile away someone was being held down on a table. Why did nobody connect it? Partly because pain was not seen as a problem to be solved. It was seen as a fact of the world, like weather. Some surgeons argued that pain was necessary, that it kept the patient alive, that a body that felt nothing might simply slip away. Partly it was reputation. Doctors who experimented with gases looked like showmen, and showmen were not respectable. And partly it was that the people who noticed were not the people with power. A dentist noticed. Two of them, in fact, and neither was taken seriously at first. Which brings us back to Boston, and to the 16th of October, 1846. A dentist named William Morton had been experimenting with ether. He convinced the surgeons at Massachusetts General Hospital to let him try it on a real operation. The theater filled with doctors who had come, quite openly, to watch him fail. The patient was a young man with a tumor in his neck. Morton was late. The surgeon, growing impatient in front of a full room, is said to have made a remark about the delay. Then Morton arrived and gave the young man ether until he was unconscious, and the surgeon began to cut, and the patient did not move. The room went silent, not cheering, silent, because everyone in that theater had spent their entire careers listening to a specific sound and it was not happening. The surgeon finished, turned to the audience and said, "Gentlemen, this is no humbug." That word humbug meant a trick, a fraud, a stage act. He was telling a room full of professional skeptics that the impossible thing they had come to laugh at had just worked. The news moved faster than almost any medical discovery in history. Within weeks it was in London. Within months it was across Europe. There was no internet, no telephone, no reliable photography. It traveled by ship and letter and word of mouth, and it still crossed the world in less than a year, because every single doctor who heard it understood immediately what it meant. Robert Liston, the man famous for 30-second amputations, performed one under ether and said afterwards that this Yankee Dodge beat mesmerism hollow. The era of speed was over that fast. And this is where the story stops being about pain and becomes about something bigger. Once patients could stay still and stay alive, surgeons could go slowly. Once they could go slowly, they could go deeper. Every operation you can think of that involves opening the abdomen, the chest, the skull, is downstream of that one Tuesday morning. Not because anyone invented a new blade, because the clock stopped mattering. There is a detail that stays with me. The men who made it happen mostly did not benefit. Morton spent the rest of his life fighting over who deserved the credit and the patent, and he died relatively poor and largely forgotten. So did the others who claimed it. The single most humane discovery in the history of medicine produced years of bitter argument about ownership and no clear winner. But the young man in the chair walked out of that room